Hey guys, welcome to our channel. In today's video, we will address a subject that is extremely relevant to men's health and that impacts the lives of many men around the world: erectile dysfunction. If you're worried about this, rest assured that there are effective solutions. Let's better understand what erectile dysfunction is and how it can be treated. Erectile dysfunction is a condition that can cause great anguish and impact on a man's life, both physically and emotionally. Simply put, it is the persistent inability to achieve or maintain an erection firm enough for satisfactory sexual intercourse. This condition can affect men of all ages, although it is more common as people age. However, it is important to highlight that erectile dysfunction is not an inevitable part of aging. Many older men maintain active and satisfying sex lives. It is a problem that may arise from time to time. And occasional episodes of erection difficulties are normal and do not necessarily indicate it. Concern arises when these difficulties become frequent and persistent, interfering with quality of life and personal relationships. Erectile dysfunction can have a significant impact on self-esteem and personal relationships. Men who face this condition often feel embarrassed, frustrated, or even depressed. This can lead to a loss of trust and intimacy issues with your partner. In addition to the emotional effect, erectile dysfunction can signal other health conditions, such as heart disease, diabetes, or hormonal imbalances. Therefore, it is important to treat it not just as an isolated problem, but as a possible sign of broader health issues. Men who experience these symptoms should seek medical advice to discover the cause and obtain appropriate treatment. Additionally, talking openly about erectile dysfunction with a healthcare professional can help reduce anxiety and stigma related to the condition, allowing for a more effective and thorough approach to treatment. Continue with this video and discover the secret to regaining your power. It is important to know that erectile dysfunction is when a man has difficulty getting or keeping an erection firm enough to have sexual intercourse. All men may have trouble getting an erection from time to time, and this is normal. But erectile dysfunction happens when these difficulties are constant. It can present itself in three main ways. The man can never achieve an erection. You get a brief erection, but not enough to have sexual intercourse. Or you get an effective erection, but inconsistently. It is important to understand that erectile dysfunction can have a major impact on a man's life, affecting both his self-esteem and his relationships. Erectile dysfunction can have several causes, and often a combination of factors contributes to its development. Blood vessel, nerve, hormonal problems, use of certain medications, and psychological issues can all play a role in erectile dysfunction. For example, conditions such as atherosclerosis, hardening of the arteries, diabetes mellitus, and complications from prostate surgery can increase the risk of erectile dysfunction. Additionally, medications to treat high blood pressure or depression may have side effects that affect erectile function. It is essential to address these factors holistically when treating erectile dysfunction, ensuring a complete understanding of the condition and identifying the best treatment approach for each individual. Erectile dysfunction can have several causes, reflecting the complexity of the systems involved in male sexual function. Among the most common factors are problems with blood vessels and nerves, which are essential for a proper erection. Atherosclerosis, for example, is a condition where arteries harden and narrow due to the accumulation of fatty plaque. This hardening reduces blood flow to the penis, making it difficult to get and keep an erection. Additionally, diabetes mellitus can affect nerves and blood vessels, impairing the ability to have erections. Another relevant factor is the use of certain medication, such as those prescribed for high blood pressure or depression. These medications can alter body chemistry and interfere with erectile function. Complications from prostate surgery can also lead to erectile dysfunction, as the surgery can affect the nerves and blood vessels responsible for erections. Erectile dysfunction is often caused by a combination of factors, and the interaction between them can make treatment more challenging. For a man to achieve an erection, several body systems need to work in harmony. First, the penis needs to receive an adequate amount of blood, which depends on the health of the blood vessels. Furthermore, blood needs to remain in the penis long enough to maintain an erection. which can be impaired by circulatory or nervous problems. Nerves also play a crucial role. They transmit signals from the brain to the penis, allowing erection. Adequate levels of testosterone, the hormone responsible for sex drive, are equally important. Without a sufficient amount of testosterone, sexual desire can decrease, making it difficult to get an erection. Finally, the sexual drive, or libido, must be present and active. If any of these systems are compromised, it can result in erectile dysfunction. Identifying and treating the underlying causes is critical to restoring erectile function and improving quality of life. We have excellent news for you. Erectile dysfunction can be treated and overcome successfully. No matter how challenging the moment seems, there is hope and effective solutions available, from lifestyle changes to more advanced medical interventions. For many men, simple changes to daily habits, such as quitting smoking, losing weight, reducing alcohol consumption, and exercising regularly, make a big difference in erectile function. Additionally, oral medications, such as phosphodiesterase inhibitors, have been shown to be effective for many men. These medications help relax the muscles of the penis, allowing increased blood flow and facilitating an erection. Other options include hormonal therapies to correct hormonal imbalances and mechanical devices, such as vacuum pumps and constriction rings, that can assist in achieving erections. In more severe cases of erectile dysfunction and other treatment options are not effective, surgery may be considered. One example is penile prosthesis implantation, which involves placing a surgical device inside the penis to allow an artificial erection on demand. Although this is a more invasive option, many men report satisfactory results and a significant improvement in quality of life after the procedure. Additionally, psychological counseling can play an important role in treating erectile dysfunction, especially when emotional issues such as anxiety or stress contribute to the condition. Qualified therapists can help men deal with these psychological factors by providing support and strategies to address challenges related to erectile dysfunction. Regardless of the approach chosen, it is critical that men seek medical advice to evaluate their treatment options and develop a personalized plan that meets their individual needs and goals. Remember, erectile dysfunction is not something you need to deal with alone. With the right help, it is possible to overcome this condition and resume a healthy, relaxing sex life. If you are dealing with erectile dysfunction, know that you are not alone and that there are several effective treatment options. It is essential to talk to your urologist to discover the best approach for your case. Erectile dysfunction can be successfully treated at any age, and finding the right treatment can make all the difference. Don't hesitate to seek help and take the first step towards recovery and well-being. Leave your like, share this video with your friends and family. And don't forget to subscribe to our channel to receive valuable content about men's health and urology. Thanks for watching, and see you next time.